My name is Craig Watson. We're going to be doing PT2 practical. First off, we're going to do the laser. We're going to be checking the C3 monotone. So I'm going to have MJ, my patient, is going to come over here. And so MJ, what I want you to do is you're going to sit on the corner here and just face that way. Okay, so before we do this, we'll give it a shot here. So we're going to have 9 at A1. We're going to have 16 at A2. We're going to have 42 at B1. And we're going to have 53 at B2. Okay? So, now that we have the laser set up, we're going to be testing the monotone. So we're going to be testing rotation of circle. So I'm going to have MJ do this. We're going to have our indicator muscle here. It's going to be our deltoids. Okay. So as MJ rotates, I'm sorry, not rotate, but laterally flexes his head, we're going to be testing this muscle here. See? Okay. So now we know that the this muscle is indicating that we have a weak C3 monotone. Okay. So first off, we're going to be treating this with both heads at the C3 level. So we're going to click start. Okay, we're going to go here, and you're going to treat that to 30 to 180 seconds. Okay, so as we treat that, we're going to stop that there, and so after we get to 30 to 180 seconds, we're going to treat that, and then we're going to go back and recheck the monotone here. Okay, so we're going to recheck that, hold that there. Okay, it's a little stronger, but we're going to so what we're going to do is actually separate the heads and laser C3 and the actual muscles that are activating that movement. Okay. All right. So neurologic head. Okay. Neurologic head. We're going at C3 here, and then we're going to be treating the muscles that are actually activating the lateral flexion. Okay. So we'll do that from 30 to 180 seconds. Click stop on that, and then what we're going to do is recheck that monotone. Bring that up. Okay, recheck that, and then we see just with that small treatment that that did fix the weakness. So it did turn on that muscle already. Okay. All right. Next up, we're going to be doing. We've got a condition of bicep weakness, and so what we're going to be doing is I'm going to have MJ come over here. Let me see your wrist here. MJ, you can just face that way for me. And so we have a right bicep weakness. So what we're going to be doing is placing this on the patient's wrist. Okay. MJ, could you step over here and just step out from that? Okay, so what we're going to do, MJ, is we're going to first start off, we're going to keep this elbow locked. We're going to have it be in slight extension. And then what we're going to do is I'm going to have MJ, basically he's going to curl his, from here, we're going to curl that all the way up into a bicep curl. Okay? So go ahead and do that for me, MJ. Okay? One more time for me. Make sure you're going to go all the way, just slightly into extension, so just move that back just a hair. Okay? Now come back from that. Alright, good. Okay, so what we're going to do is, when this patient does this, you want to continue the exercise. You're going to do 3 sets of 6 at a slow pace. We're going to do increase the resistance by 3, and then we're going to do 3 sets of fatigue until at a slow pace, and then we're going to do 3 sets of fatigue at a fast pace. And that is going to be it for bicipital weakness. Okay. So up next, we're going to be doing levator scapula. Okay. So MJ, go ahead and remove your shirt for me. And you can actually go ahead and just sit down here and face that way. I'm going to use the acupressor. Start off with I would have okay, so what we're going to do is we're going to abduction exercises to get that tissue. So levator scapula is going to run right in this area here. And so first up, I would heat up this with a hydrocollator pack. Or a device that I could heat up the muscle. So what I'm going to do is actually get MJ to pull his arm down just like that. So we're going to lengthen the muscle so that we can get a good and nice result with our Graston tool. So we are going to throw some light on here. Okay. All right. So we're going to keep that. We're going to keep that muscle lengthened so that when we actually perform the Graston technique, what we're going to do is we're going to scan this muscle here. We're checking for any grittiness, and so we're going to do this, and then once we find some grittiness, we can check it in all different planes. We want to make sure that the bevel side is up, and make sure that we're doing that at 30 to 60 degrees. Okay. Okay. And so what we do is, so when we actually find a place where there's grittiness, so if, for instance, I found this part right here. When we find that place and you do the star pattern and you find that most resistance, then we're going to work that for up to 2 minutes or until we see excessive fatigue. Okay. So after that, we're going to stretch the muscle, and we can do that by lengthening this muscle here. And then what we're going to do is we're going to rehab the muscle, so we can do shoulder raises or a appropriate exercise that would be strengthening this muscle here. And then lastly, what we would be doing is, obviously we're going to be performing the Graston technique, but lastly we're going to be doing cryotherapy. Okay.
The last thing I'm going to demonstrate is tabletop exercise.
Okay. And I'll just do this from here. So up next, we're going to be doing supine piriformis. Okay. So what we're going to do is we're going to cross over the foot across the side, and then you're going to have the patient grab the back of their leg, okay, on the opposite leg that they crossed. So when they grab that, we're going to be performing that stretch. You're going to be feeling it on the right. This is going to be for your right piriformis stretch. Okay, so that is going to be for supine piriformis. Through that stretch, you want to make sure that you activate the core, keep that core activated, and that's it.